Hey everybody, in today's episode, it's myself, Benjamin B, and Dr. T. We're talking all about marijuana. There's been a couple of clips going around lately, gone pretty viral, and people are kind of celebrating marijuana and its medicinal purposes. So we wanted to come on and talk about the negative consequences that are brought forth by marijuana. But before we get into the episode, I do want to congratulate Chris on 6 months of continuous sobriety. Chris, congratulations. You're crushing it. I know you're going to love this. Enjoy the show. Here we are, Real Recovery Talk. I'm your host, Tom Conrad. In today's episode, we've got Benjamin B.
What's happening, everyone?
And we've got Dr. T.
Hello, everyone.
First things first, thank you for tuning in on the podcast app, whichever one that you choose to use, and thank you for watching on YouTube. In the end, if you have any comments, questions, or concerns, you could always reach us, info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com, and ultimately, we want to help you turn your mess into your message, right, peeps?
Yes, sir.
Yep. I just got yelled at for fidgeting around, and look who's fidgeting.
No, I'm taking my Apple Watch off because I don't want the notifications going off on my wrist.
That's why I stopped wearing an Apple Watch, because I had anxiety from it, and so I couldn't do it.
Yeah, this is the third one or fourth probably, and I've sold every one for a fraction of the.
We should get a Whoop. The only thing I use it for is sleep tracking and my calories burned.
Well, I don't care about that stuff. I just want to know what time it is.
Oh my God. You have a phone.
Yeah, I have another watch too that I like wearing. What's up, guys? How we doing?
G-Shock.
Good.
Good.
Yeah, G-Shock. You've had that a long time.
Mm-hmm.
Years.
A long time.
Yeah.
I had one of those in 8th grade. No, I'm just kidding.
All right. So today's topic is going to be marijuana. A lot of buzz going on right now with marijuana. I know Mike Tyson had a clip go out recently. A lot of people are kind of pushing for this. You know, I heard him saying that it's medicine. Shut up. It's not medicine, dude. Like, I suppose in certain instances it can be, but you know, I guess for our population, it's definitely not. I think that people shy away from the actual evidence of the harm that it does to young people. And, you know, look, Mike Tyson, you're 60 years old or whatever. You've been punched in the head a gajillion times. Like, marijuana is not going to probably affect you any more than, you know, a boxing glove has over the last 30 years. Like, if you want to go out and smoke, go ahead. Same for you, Joe Rogan. Like, you could do it successfully. You're a multimillionaire. You're an entrepreneur. You've done very well for yourself. But be careful what you say, because you're also, you're spreading that message to a 19-year-old young guy that is going to turn schizophrenic because he listened to Joe Rogan, and Joe Rogan says that, you know, marijuana isn't bad for you. Now, that's a very blanket statement, and I know that Joe Rogan would agree, like, I think there's some common ground there, but the overall message, you could tell a 19-year-old anything and they're going to hear what they want. So anyways, we wanted to do a talk on this because it's bullshit. Ben, go ahead.
Yeah, I wanted to talk about this because I've definitely noticed an uptick in the amount of mental health. We were kind of having a discussion about it this morning via text with Dr. T, where it's like, I'm seeing more mental health cases than ever before, and it's literally been in the last, couple years. Like, back when I started in this field in 2016, you had just most of the people that came to treatment were there for substance abuse. And like maybe had some mental health secondary, like some depression, maybe a little bipolar, something like that. I have never seen so much schizoaffective disorder, schizophrenia, auditory hallucinations, visual hallucinations. There, especially in the 18 to 25 category. And I can't help but correlate that to weed. Like the weed, back when I smoked in high school, I graduated high school in 2002. I think the weed back then was like maybe at the best 20% THC. I just researched it. The strongest strain today has 45%. And that's not even getting into the concentrates like the shatter and all that stuff, which is like 96% THC. But the the cannabinoids, I don't know the science behind it exactly, but I do know that it triggers schizophrenia, especially in young men. It's more prominent. I'll let Dr. T speak on that.
Well, I mean, we were like back when I went through medical school and even like undergrad, because I majored in psychology, there's always been this correlation between that smoking THC can unmask a diagnosis of schizophrenia or bipolar with psychotic features or schizoaffective disorder. And so it's a well-known fact that, and usually like schizophrenia has what we call like a bimodal presentation. So that age range that we're talking is usually when it can first appear. And it's usually in people who have a family history of these mental health disorders. So when they smoke weed, it just sets that off and it can make that presentation come on earlier than it would have in that person's life. That's one aspect. I think the other aspect, like you said, is that the concentrates are so high now and they are getting this dopamine surge and, norepinephrine, all of these neurotransmitters, and they're having hallucinations, psychotic features. I did recently read an article that there's been more ER visits in that age range, like 18 to 25, from marijuana use. It's been an uptick in like the last 3 years because of the high concentrate. So people aren't like really seeing like the negative side of it.
Yeah, I think I saw a highlight like that too, where the hospital visits to the ER, like people going into psychosis as a result. And like, I think they come down from it and then they're okay. But it just goes to show how strong the weed is. But to your point, if somebody has genetically, they're predisposed to having schizophrenia or some mental illness, there's no turning it back. I've also heard, I don't know if this is 100% true or not, but like there's people that are genetically predisposed to being schizophrenic. If they never touch weed, they're like fine their whole life, and they smoke one time and all of a sudden it sets it off. I've heard of cases like that where they believe that to be true. Like as soon as they smoked weed, they became schizophrenic. So,
hey everybody, this episode is brought to you by SoberLink. We decided to partner with SoberLink because it is a tool that we believe in. Now, here's a couple of things about SoberLink. Number one, it's not designed to catch you in a relapse. It's designed as an accountability tool. Now, there's a bunch of cool features with SoberLink that I think need to be discussed. Number one, it is tamper-proof. You can't mess with this thing. You can't break it. You can't fudge the results in any sort of way. It also has built-in facial recognition, so you can't just pass it off to your buddy and say, hey, will you blow in this thing for me? It has scheduled tests, so you can set it up. I want to be tested at 7 a.m., noon, and right before dinner. You could set it up to where your results get sent to an accountability partner. That could be your therapist. That could be one of your sober supports. You obviously will have influence on where the results are sent to. Again, SoberLink doesn't take the place of Alcoholics Anonymous. It doesn't take the place of addiction treatment, but it's an added tool, right? We oftentimes talk about tools in our toolbox when we want to stay sober, and SoberLink is a great resource. And I've seen people utilize it, and just knowing that it is there, it's, hey, I got to blow in this thing. It can help you in your sobriety journey. So we're super glad that we've gotten to get involved with SoberLink and have them now as a sponsor. And because they are so generous, they wanted to offer you a discount. And you can go to soberlink.com/RRT to receive 50% off of your device. I mean, I definitely can see that happening. There's somebody that is dear to me. All of the issues that this person has ever had has been a direct result of marijuana use. And, it started at a young age for this person. And fast forward 20 years later, thankfully, they're in a much better spot. But that's after multiple visits to psych wards, multiple different prescription medications, only to finally go on to what seems to be permanent antipsychotic. And this person even agrees it is directly attributed to my marijuana use. And it kind of happened very quickly, and I think that's why I get so upset and frustrated when I hear people that have these huge platforms talking about all the good that marijuana, and listen, my dad, and I've talked about this on the podcast before. I think there's a time and place for marijuana use. Absolutely. It helped cut my dad's opiate use down by, a lot, 2/3 of what he was using but it was justified use through an autoimmune disorder that he has. Totally fine. I'm cool with that. And obviously other certain instances, but those don't make up the majority of the marijuana users in this country. I don't think. I've never done any sort of research to see that. But then it also brings in the question, what is the criteria in order to get a medical card? We're in Florida. If I wanted a medical card, I could probably have one by the end of the day.
100%.
Yeah, because you could just go and that Florida. Well, it's actually in Florida per se. It's like PTSD, autoimmune diseases like Crohn's, ulcerative colitis, irritable bowel disease, chronic pain. So there is criteria that you have to meet, but you could go into a doctor and be like, yes, I have PTSD. I suffered, whatever trauma in my life and I need my medical card. There's no record review. There's no record request. They just sign it off and say, okay, no problem. And then they put you in and you could have your card by the end of the day.
I have to take my dad every month to the pain doctor because he's on opiates, and they do both. They do pain management and medical marijuana, and it's just turn and burn. Boom, 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 boom. Every minute. Literally, I have timed me and my dad in the actual doctor office in the when they go in room 2, please.
Mm-hmm.
We go in room 2. I've literally timed it down to 1 minute and 30 seconds. They walk in. Any changes? Nope. Pharmacy still the same? Yup. Any questions? Nope. All right. See you later. That's for the opiate side of it. And I know it's the same for the medical marijuana side of it.
Yeah, I'm not totally anti recreational. I mean, again, I'd rather see legal weed than alcohol, to be honest. But so to each their own. But yeah, you were specifically saying our population of addicts and stuff. And I'll speak for myself because I don't hear too many people come out and say this, but I was absolutely addicted to pot. There in high school, there was no question, both mentally and I'll throw it out there physically too. And I'll give an example of when I realized it was physical. There was a point in time, I was an all-day, everyday smoker. The first thing I did when I rolled out of bed, within 5 minutes, I was smoking a bowl. And that went on all day. I wasn't the type, don't get me wrong, I would sit down with other people and smoke, but I literally kept a bowl in my pocket at all times and would hit that thing at least every hour, whether I was in school. It didn't matter where I was. I used to walk through the hallways of high school and just go around the back way, back by the track to get to my next class and just rip the bowl real quick, constantly smoking. But where I'm going with this, there was some reason in high school where I had to stop temporarily. I don't remember exactly what it was. I remember it was 10 days that I went without it, and I lost 10 pounds within a week. And what I'm getting at for the physical part is I literally got so used to having the munchies that once I stopped smoking, I couldn't eat. I completely lost my appetite. Not to mention the mental side of it. I would go into fits of rage if I didn't get high. If I didn't have weed, I would fall apart mentally. And I will say, I totally believe it exacerbated my depression too. Those were some of the worst bouts of depression I had was at that age. And I will totally correlate weed to that. It can absolutely be harmful. Now, again, there's exceptions to the rule. And I'm just going to go ahead and say this is my opinion based off my experience in life. Exceptions like Joe Rogan, extremely successful. But like, to be honest with you, most of the potheads I know are like not the most productive members in society. Like the ones that I know that smoke all day. I'm not talking about the guy that like
smokes once every couple weekends.
Yeah, like on the weekend or like in the evening takes 1 or 2 hits. I'm talking about the person that's a burnout. Like generally speaking, they're pretty unproductive and their life never gets put together as together as it could be for that individual. They're not reaching their peak potential. Everybody has a different potential, but I'll say for them, definitely, in my opinion, holds them back.
One of the things that we look at, because up until recently, kratom wasn't really talked about much.
Mhm.
And in fact, it was oftentimes, and still to this day, is somewhat celebrated. Kratom isn't that bad. Well, insurance companies have now started covering treatment for people that are addicted to kratom. If it was so good and it really didn't cause any problems, then insurance companies wouldn't be covering treatment for people addicted to kratom. Marijuana is the same exact thing.
Mm-hmm.
We've had people that come into our program, their primary drug of choice is marijuana. Because their life has become unmanageable by way of pot. They've suffered the same consequences, whether it's physical, mental, spiritual, emotional. Their life is an absolute wreck because they can't stop using marijuana. And so insurance companies, thankfully, have said, okay, we're going to start covering treatment for this. And there was, up until recently, a lot of programs that were offering marijuana maintenance programs.
Mm-hmm.
That's no longer, I think, is it illegal here now?
It's illegal in Florida.
It's illegal in Florida to have medical marijuana programs, which is amazing.
For addiction.
Yeah.
Yeah.
Because, and this is the last thing I'll say, and then you guys can chime in. A lot of times I think people use marijuana just the same as they would use any antidepressant. They would use any form of anti-anxiety medications. It's the quick fix, you know? Oh, I'm depressed. Well, I'm not. Well, you said oftentimes criteria is PTSD. Well, rather than actually maybe going through EMDR or some form of extensive therapy with a trained mental health clinician that's trained in EMDR, that is trauma trained, rather than doing that, I'll just go to the local medical marijuana plant and get my medical card. But it never addresses any of the underlying issues. And that's the problem with it, is that people utilize this whole medical marijuana crap as a complete cop-out. Again, I'm not talking to the people that it's actually justifiable, cancer patients and, Crohn's. I'm sure there's instances where it makes sense. We're not talking to you. We're talking to the average person, especially the young adult male addict and female, but males is where a lot of the studies are showing a lot of adverse reaction.
Definitely.
So if we look at medical marijuana as a whole, and we look at the treatment aspect of it, again, it has become, just like I was saying with kratom, it was celebrated. Medical, or just marijuana in general, oftentimes is celebrated. It is something that is extremely socially accepted, especially when you have big named people like Joe Rogan, like Mike Tyson, remember Demi Lovato was doing that whole California sober crap, saying that this stuff is okay. Well, when the person finds out that it's not okay, what do we do?
And who's left to pick up the pieces and help them?
Yeah.
Yeah, and to your point, you brought up kratom, which I think this goes hand in hand, which is something to keep an eye on. And again, I'll go back to potency increasing. Like, we are seeing an uptick with the kratom, for instance. Now they have the, not the concentrates, what do they call it? The alkaloids. They're breaking it down, and the gas station has stronger kratom than they did 10 years ago. So 10 years ago, it affected the people that already had previous addictions, opiate addictions. Like I remember when kratom first started like blowing up in like 2013, 2014, at least down here, for people would be in the halfway house. They didn't have drug tests for it yet. And it was like the new thing for addicts to use and not get caught, when they're trying to be quote unquote sober. But over the years, it's getting stronger, just like weed. So now it's even potentially people that weren't predisposed addicts with the previous opiate problem. Now kratom is so strong that they're becoming addicts as a result of that, So, and it's the same thing with weed. It goes hand in hand. Like these drugs are getting stronger as time goes on.
Mm-hmm.
So something to keep an eye on. It's evolving. The situation, if you asked me back in 2005, I was in active addiction back then, but let's say I had a healthy mind, I would have been like, yeah, weed's fine. Recreational, go ahead, no problem. But I don't feel the same way today. And it's not just because of my recovery. It's literally so much related to the increase with it.
Yeah. Yeah, I'm with you. Like, from a medical perspective, I know like the pathophysiology of it. Like, there's 2 different receptors. One of the receptors that the THC hits is in your brain, areas that are important for like executive function, focus, attention, memory. And then you have another subset of receptors that it hits, and it's involved with like mood and immunity. So I get the general medical argument about the anti-inflammatory, the pain aspect, even with some of like the depression and stuff, but I don't think it's the end all be all. I am not opposed in the normal person without addiction problems. Like you said, recreational use every now and again for whatever reason, for fun or as needed, fine. But when it gets beyond that, like you said, when it's a daily thing, like it can affect your memory. And it's like any other substance. Name your substance. What is it doing? You're numbing your emotions. You're depleting all of your dopamine, serotonin, norepinephrine, right? You need it every day because you're going through this cycle where you're getting a surge, it's dropping. You need to smoke more. You're getting a surge, it's dropping. You just get into this repetitive cycle. And now you're, not necessarily physically dependent, but you're mentally dependent on it. And then you get into it, just spirals out of control. So definitely in the addict population, I don't think it's a good idea at all. And just because we know with people who have family history of schizophrenia, bipolar, that it can unmask that, you have to know what you're getting into as an adult too. So.
Yeah.
Not good stuff. I think.
Yeah, and I'll say this too, because we brought this up because of the mental health part. Like, we get a lot of calls from parents. I'll start by saying that. We're like, they'll call in first, my kid has a problem with weed. And I'm like, oh, how bad could this be? And then they get here and you completely find out their primary mental health case. Weed is always involved somehow. When the parent calls in for the kid and they got a problem with marijuana, it's almost like one thing that I'm seeing is I'm sad to say this, but it's the truth. The parents are oftentimes sending their kid to a substance abuse treatment center. Like, if the weed goes away, then what's going on with them will stop. But what we're finding out is they're actually a primary mental health case. But I'm like, where's the correlation between, do people with mental health just love marijuana for some odd reason? What came first, the chicken or the egg?
Exactly. We don't know the answer.
We don't know the answer to that. Yeah. And it's like, I can't help but think they started smoking weed and then triggered their genetically predisposed mental health.
Mm-hmm.
Well, and you're never going to find it out unless you come off of the weed for a substantial amount of time, not like 30 days. We're talking months.
We've had quite a few. I can think of 3 right off the top of my head. One of them still in this area.
Yeah.
Very good family, very good kid. But unfortunately, like, he did stop for a long time and it's just played out as mental health now.
Yeah.
So
it becomes permanent, I feel like. Maybe they could get out of the psychosis in the beginning, but then they smoke again.
And it's just like a vicious cycle.
And then at some point, the mental health is just like stuck. Yeah. And I'm not going to knock. I'll throw this on a more pot to any of the haters that are like, oh, they're bashing weed. Like, I'll throw this out there. Like, I know some older guys that are like 60 that have literally been smoking weed since they were like 10 years old, and they're down on Lantana Beach. Like, they're just always stoned, always surfing, always fishing and eating their own organic sushi. Like, bro, living life up. Like, more power to you.
I agree.
I'm not knocking
Sounds
those
nice.
people. Like, they're some of the greatest people I've ever met, and they're just content with life. Like, I'm always going to have dirty feet and red eyes and surf all
hair,
day. And long hair that's salty. Like, cool, man. Good for you. But, like, I'm starting to see something different, and that's why I wanted to talk about this.
Yeah.
Yeah, my issue is, like I said, it's promoting it, you know? Realize the platform that you have and realize that potentially millions of people are watching. Like, look, if we were to go out and say, hey, marijuana is great for you, marijuana is medicine, it's not going to reach it'll reach a decent amount of people. But some of the people out there that are pushing it, they reach far more. And we're the ones that are fielding those calls from the parents that, hey, my 20-year-old son seems that he's having some form of mental break. Now, I'm not placing blame or responsibility on the people that have these giant platforms that promote this stuff, but be careful because you don't know. And I can tell you, like, I doubt somebody that has a platform of that size, whether it be Joe Rogan or Mike Tyson or whoever, come step foot in our facility for a few days and interact with some of the people that we interact with on a daily basis, you would change your tune.
Yeah. I think it's important to bring up too, again, going back to the population that we treat. Every time we talk about this, I think it's important to bring up. For instance, I don't necessarily think, like, say you have a fentanyl addict. I don't necessarily think that smoking weed is going to bring them straight back to fentanyl. Like, oh, I smoked weed, now I got to get a better high, I'm going to do fentanyl. I personally, is that the case with some people? Sure, they want a better high, they go back to fentanyl. I do think overall it makes it harder to get sober if you're smoking weed, because it takes you away from all the things that helped you get sober to begin with. For instance, if you're somebody that came in on fentanyl and alcohol and you went to Alcoholics Anonymous or Narcotics Anonymous and that helped you get off that stuff, then you start smoking weed, you're probably not going to show up stoned to those meetings because you're not going to feel like you fit in. You're going to lose your tribe, you know? And so a lot of people are looking at it when they hear, oh, marijuana will bring you back out to your drug of choice. They're looking at it as a direct cause. I look at it more of an indirect cause people don't consider. Like, it's the people, for instance, if I build a community of sober people that don't smoke weed, when I start smoking weed, they're not going to hang out with me. I'm not going to hang out with them. It takes me right away from those people that helped me get sober to begin with. And then it's those small little pebbles that trip you up.
Yeah.
Takes away all your tools, so to speak. So I just always love throwing that out there because people like think, if you smoke weed, you're going to get high on something else again. No, but it could very potentially take you away from the things that helped you get sober to begin with.
Yep.
Yeah.
Well, that was fun. Anything else?
No.
How was the weekend? It's Monday. Or no, what day is today?
Tuesday.
Today's Tuesday.
It was good. I just worked.
Yeah.
Nothing exciting.
I went to Alley Cat.
What's that?
EDM.
Oh gosh.
Oh gosh.
How was
you didn't
that?
see my story on Instagram?
No, I was
No.
in the Florida Keys.
Oh, that's right. We'll talk about your weekend then.
No, I want to hear about yours.
Oh, it was nothing eventful. It was just music and
Would you go with Destiny and
Yeah.
Geo?
to Chemistry in Fort Lauderdale.
Oh, was it fun?
It was.
What
It was
is
cool.
chemistry?
A club down there.
Oh.
It's fun. Yeah, it was like we got VIP, so it's nice. So you're not like in the crowd. You're like separated, and then couldn't even stay the whole time. I left early.
Huh.
I'm getting too old for that.
Yeah.
Yeah, I'd say so. You're probably like a grandfather there.
Yeah.
Yeah.
Like, hey, Papa Ben's up in VIP.
Yeah.
Yeah.
He's the only one that can afford it.
I bought tickets to go see Matt Rife.
Did you?
Yeah, in December
Nice.
in Orlando. Amanda doesn't know yet, but I got like not front row, but I think 4 rows back because he does crowd work.
Oh, really?
Oh yeah, that's like his whole thing.
Okay.
Well, at least all the stuff I've ever seen from him.
Yeah.
So I'm like, I want to pay the money to get up to see if he'll work me or work her.
Oh my gosh.
He's hilarious.
You love being in an uncomfortable
Yeah.
you live for that.
Oh, for sure. I mean, it's like it's exhilarating to be up there, and
I shy away from that, and you just dive.
Is he gonna
in.
pick me? I'll do something goofy. Hey, Matt, you whatever. Maybe he'll pick me. But he was on Kill Tony last night. So
Your favorite show?
Oh my god.
Kill Tony's the best. Have you ever watched it?
I watch what you make us watch.
No.
Apparently, try to show us the best clips, and I
don't. I just show you clips.
No, you're like, watch this one. I'm like, dude, not funny.
Do you like stand-up comedy?
Yes.
Then you need. Then you're not a true stand-up comedy fan if you're not watching Kill Tony. You're not. That's just the way that it is. Yeah. So, anyways, I bought those. That's fun. It's in December.
Okay.
That would be a good show.
Yeah. And then I'm going to Morgan Wallen.
Oh, nice. Where is he going to be at?
Miami.
Oh, is he?
Yeah. And
is it at the where is it?
It's where the Dolphins play.
The Hard Rock. Yeah.
He's an alcoholic.
Levi told me that he's sober now. Which I mean, Levi's 9, so I don't know how he
but
would
kids
know
these things.
He should be sober. He in Nashville, I think it was
at his bar.
He threw a chair.
At somebody drunk or something over his ex or something.
Yeah. Yeah, I don't know. Levi knew the whole play-by-play.
Oh, really?
Yeah, he's like, "Oh, yeah, Daddy threw a chair," and then he went into a rehab program. I'm like, "How do you know this stuff?" And then shortly after that, going to Benson Boone.
What's that?
Yeah.
Benson Boone?
That sounds familiar.
Oh man, he was the he's young. He's only like 21 or something. And he was a really good diver, high diver person,
Yeah.
And somehow ended up in music, and I'll play a song. I know you know.
Was he on American Idol or one of those things?
Yes.
I think he was. Yeah, that's how I know.
And he wears the onesies.
Yeah.
So I have to wear a onesie to the
Oh my god, your poor children.
Yeah. Let's see, I was in the Florida Keys, me and Stevie Buckets over the weekend. That was fun. Steve got violently ill.
From
seasickness.
Seasick.
Yeah, that would be me. That's why I can't do the Keys.
I got video of it, and
did you? I didn't see the video.
Yeah, maybe I'll put it in the YouTube video here.
Sweet.
So if it pans to the video, there you are, Steve, puking over the side of the boat. But I did have, because I think last year or the year before, you wrote me a script for scopolamine.
Yeah.
And so I took them down and I gave him one that night after he got sick, and went out the second day and he was fine.
I can't believe he went back out. I would have been like,
oh, he was a trooper.
I'm done.
He was a trooper the whole time. I mean, he's literally blowing chunks the whole entire time. Didn't ask one time to go back.
Oh, no.
He did awesome.
No, I would never ask to go back. Once you commit, you're on.
That's why I
can't.
just wouldn't go.
Yeah. And I told him that before I said, you get sick, you're stuck.
You know what the worst part for me, though, is on those trips, you hit 4 to 6 foot seas, it's the up and down and the boom with the hole, my back can't handle it.
Yeah.
My lower back starts to hurt so bad.
Yeah, and then the last day we ended up going down to Key West, me and Steve.
Did you go to a drag show?
No, but there were quite a few of them.
Yeah, they have good ones down there, I've heard.
Good ones? What do you define
shows,
good ones?
The shows are well known across the United States. Entertaining.
Yeah, I mean, it was they were pretty fascinating. I had never seen anything like that.
Have you been to one?
No.
Never in your life.
No.
I would love for us to go.
So we were
bring
just
Tom.
Yeah, we were just talking how Tom likes to be in uncomfortable situations. Like when they see an obviously straight man like you,
They will
go towards you and pick on you, basically.
Oh, I would embrace it. I would get.
I know you would.
That's why I said
that's
it would
why
be
I want to bring
fun.
you.
Yeah, whatever. Well, I'm not. I probably won't ever go, but Anyways, it was a fun weekend, and tonight is Family Reconnect week 4. It's been doing great. I love it.
It's been fun.
Yeah, we have a new person coming tonight. So that should be fun. And so Family Reconnect, obviously, realrecoverytalk.com/FRC to get all the details, or just email us, or you can always hit us up on the socials. Real Recovery Talk Tom, Real Recovery Talk Ben, Tambini. She doesn't believe in social media. So yeah. Anyways, anything else?
No, sir.
T?
Mm-mm.
All right, that is it for this episode of Real Recovery Talk. Thank you for tuning in. In the end, if you have any comments, questions, or concerns, you can always reach us, info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com, and ultimately, we want to help you turn your mess into your message. That is it. We will see y'all later.